Very important, probably for me, one of the most important are the psoas muscles. They attach under the lumbar spine, underneath there. You can't get to them very easily. You can't get to them at all, really. And at one end, and at the other end, they attach under the pelvis and down on the femur. But these muscles that attach between the underside of the pelvis and the lumbar act as a stabilizer. I think of it as a big piston here. And they create stability in this whole junction. They also have to function in a healthy manner in order for the sacrolumbar junction to function. That's not a poem. So we have the sacrolumbar junction. It has to be able to hinge here between the pelvis and the lumbar and the sacrum. It has to be able to hinge in order for the horse to reach under behind. And in order to get collection, that has to be working properly, or it's very difficult for you to get collection in the horse behind. So that makes sense, I hope. So this junction here, psoas muscles, and this junction. And there is a joint in here on each side called the inner transverse process. It's part of that hinge in the sacrolumbar junction. When the psoas stop working, this junction stops working, and that joint there stops functioning normally. So there are 6 release points that we have in this method, and they're explained in the Beyond Horse Massage DVD and book. But there's another one that I want to add in here for the dressage horse, because this junction is so important. And it's the psoas area in here. Mentioned a couple times how important this junction is here, the ability of this area to bend, to flex. It's like a hinge for the pelvis to rotate down and the horse to be able to step over. The psoas muscles, which I already described up under here, whenever the horse is relaxed in the leg like this, you want to search for a blink in this area, just on this side of the spine, in front of the pelvis. There's a little triangle in here, and search for the blink, because this is going to send signals to the psoas muscle to release. I'm going to search in here. There's a blink there. I'm going to keep going and look for a really good one. Right there. I'm going to stay right where my fingers are. This is, for some reason, this is an amazing point for releasing tension in the psoas muscle and in getting some normal function back in this joint. Now if he switches back and forth, if he goes to the other leg, I'm going to go to the other side. Okay? Here we go. Something's letting go. There we go.